All right, in this video, we're going to talk about mobilizing thoracic spine in the prone on elbows position. All right, so we pre-position our clients in a prone on elbows position. And then if I know I want to at least assess this left side's ability to close, basically, then I'm going to stand relatively on the left side of my client. All right, now I'm going to bring her left hand to her right shoulder. And most people are very confused as to what you're asking to do. Like, okay, take your left hand to your right. Don't do it right now, but take your left hand to your right shoulder. And then they like try to do some weird like motion like this. I'm like, okay, we're going to take the left hand to the right shoulder. I'm going to raise this whole arm up and you're going to put your forehead in the crease of your elbow, just like that. Okay. So now she feels secure. Like I have her here. I have a wide base of support for myself. I'm able to sit into my feet, right? And then it makes it to where, you know, the closer you can be with your client in this position, the better, okay? So she's here, she's relaxed into my arm, all right? I don't want her to be like firing through all of her paravertebral muscles here, right? We don't want tons of lumbar compression, all right? But if I have her in this position, now I can take her through a localization where I'm actually tractioning through my assisting arm. I'm kind of pulling with my scapula, pulling her long. That actually decompresses her lumbar spine a little bit. But I'm pulling her long, and then I can take her and assess into this closing motion here, okay? So the last video was in prone, working on kind of this relative motion. Now we're biasing her into a little bit more extension. And now I found my hard infill here on the spinous process, on the left side of the spinous process, inferomedial, okay? I'm tractioning through here and I get to that infill and then I can have her just pull her arm down into mine. Good. And I have a nice stable base of support using my feet, pushing my feet into the floor and let it go. There we go. And then I'll just keep relocalizing into a little bit more traction. And then side bend left, rotation left, and extension there, okay? And then pull down. And let it go. And you can do all those things at the same time, but I'm just trying to spell out kind of what my intention is really traction, side bend left, rotation left, and then extension, okay? And then pull down there, Kelsey. Good. And I'll continue to do little muscle energy techniques there, little functional mobilizations until I feel like I got her to where I want her from a mobility standpoint. And then she may not have the stability to do this, but we're going to see. Push long through your right forearm, Kelsey. There you go. Hold that and then keep your left elbow high towards the ceiling. Perfect. Good. Hold that there. Hold that there. I'm going to bring my finger to the opposite side of that spinous process. Really hold that there. Good. Pushing long. And I can even add in some rotator cuff. Ooh, there, okay? I could also add in a little bit of extra resistance here that gets a little more lower trap, but she's really shaking and relaxed down. And then from here, I would just, to get her back down, just have her put her arms back down. And then after that, I normally give their low back a little rest so you can cross your arms and just put your forehead down like that, okay? So that's just assessing one side. Then you would want to do the other side. A big thing to remember is when she brings her, like you'll get them into prone on elbows, go back into prone on elbows, and you're trying to decide, okay, I want her to move into this direction. Which hand do I bring across? And the truth is, you could bring either hand across, okay? The bigger question is, do I want to, ultimately after I mobilize, do I want to facilitate serratus on that side, or do I want to facilitate lower and middle trapezius on that side? Okay, so this is just an interesting thing to think about. If I bring this hand across here, right, and then I mobilize here, right, then she'd have to push long through her left arm, and we're going to use serratus as the facilitation, okay, more so for this side, for the shoulder girdle, versus what I did. Let's switch that out back to there. Okay, and now we get to here and get to where we want to be, and we're facilitating serratus on the opposite side, lower trap on this same side. Okay, so it's just something to think about when choosing the arm of like what needs to be facilitated after I do this mechanical treatment. Okay, so this is treating thoracic spine in the pronon elbows position.